I'm Brian Shaw, Certified Diabetes Educator with Sacramento Native American Health Center. Welcome to another episode of Take 5, Ask 5, where we take 5 minutes to ask 5 experts the top 5 things to know about what they know. Today we're going to talk about diabetes and foot care, and we have a special guest, Dr. Parminder Jager. He's SNAC's podiatrist. Dr. Jager, you've been here for 4 years.
Yes.
Welcome. What can you tell us about foot care and diabetes?
Absolutely, Brian. Yes, so there's about 30 million Americans who have diabetes. Approximately by 2040, 60 million Americans will have diabetes at that point. What's important to know is about a quarter of those people with diabetes will have some sort of foot ulcer, and therefore a diabetic foot exam is very important, and for everyone to have a podiatry foot examination specifically at least once a year. In addition, there's the top 5 things that we're looking at specifically. Number 1 is to control your sugar levels, and that can be handled with any of our SNAC primary care physicians or our nurse practitioners. They do a wonderful job. Your goal is to keep your hemoglobin A1C under 6.5 and below. Generally, that means your blood sugar level should be about 120 or so. In addition, the second thing we need to do is check your feet routinely. So look at the bottom of your feet, use a mirror, which we have here, and look at the bottom specifically to ensure there's no cuts, blisters, or wounds, or calluses. If any of those things happen, even a blister, you want to notify a medical professional as soon as possible. Number 3 is Lotion Hydrate. So there's often many memes about hydrating, but in this case you should be hydrating your feet specifically. That means that apply lotion on the bottom and top of your feet, not in between your toes, and specifically looking at any lotion or cream specifically targeted for diabetics. Number 4 is to wear shoes, and the shoes should entail wearing shoes that are wide enough in the toe box, as Brian shows here. So you want to ensure that it's wide enough in the toe box, as often you have corns, calluses, or even ulcers that could lead to infections in the future. So therefore, make sure the shoes are properly fitted. Approximately about 15 to 20% of my patients specifically wear the properly fitted shoes. Most of them do not have the correct shoes, so make sure your shoes are fitted well specifically. And number 5 is to see a podiatrist at least once a year. If you have neuropathy or nerve damage, those are very important things. And so diabetes affects many of us, and it affects diabetic patients in a few different pathways. 1 being a weakened immune system, 2 specifically your blood vessels, your circulation, so it could impact that, and thirdly is a lack of sensation, and therefore that's where you get the foot ulcers and infections and unfortunately amputations. So it's very important to prevent those sort of complications with your feet, and that's what we're here at SNAC for specifically. Both the podiatrist as myself and all of our staff members are here to protect your feet and make sure you can prolong your life for as long as possible.
Great. So the top 5 things to know in review for caring for our feet when we have diabetes. Number 1, keep your blood sugar in control. Work with your doctor about your blood sugar ranges and your A1C to make sure that your blood sugar is in proper control. Right? Number 2, check your feet daily. You could use a mirror like this when you get out of the shower, sometime that you have set aside to make sure you check the bottom of your feet in between your toes to make sure there aren't any injuries or ulcers. Yeah. Number 3, hydrate. Make sure that your feet are well hydrated. Choose a lotion that is for diabetics, but not in between the toes.
Yes.
Okay? All right. Number 4, make sure that you are wearing properly fitting shoes, right, to protect your toes and protect the toe box.
Correct.
Okay, and number 5, see your podiatrist once a year. Come see Dr. Jager or your podiatrist if you go somewhere else to make sure that they can check you to make sure that you are not going to develop any of those diabetic complications.
Yeah, perfect. Yep.
Straightforward. Dr. Jager, thank you so much for being here today. It's so nice to see you. Thanks for your advice.
Anytime.
Yeah. Tune in again for our next Take 5, Ask 5, and we'll see you again. Goodbye.